Hi guys, this is Ramya Ranjan working as an assistant professor in Biani Institute of Science and Management. Today I am going to take a topic on pelvis, especially the female pelvis. So first of all I am going to take the function of the pelvis. What are the functions of the pelvis? The first function of the pelvis is it helps us for the all body movement. For example, walking, sitting, jumping, running. The pelvis helps us in all these actions. Next is it acts as a bridge between the two femoral bones. These are our two femoral bones, which is our legs, two femoral bones. So it acts as a bridge between the two femoral bones. Pelvis helps us between the two femoral bones. It acts as a bridge between the two femoral bones. Next, it transfers the upper body weight to the lower body weight, because pelvis in between this, so it transfers the upper body weight to the lower body weight. Next function is it helps for child bearing, because pelvis is an organ in which the child, pelvis is a birth canal in which the baby moves and which comes to the outside of the body. So it helps as a child bearing organ. Next, in ischial tuberosity located in the pelvis, which is help for sitting. I will show you what is the ischial tuberosity. It is present in the pelvis. It is the thickest bone of the pelvis and is the strongest bone of the pelvis, in which we usually sit on this bone, which is the ischial tuberosity. Our whole body weight will bear on this bone, which is the ischial tuberosity. Next is the ischial spine, which is also present in the pelvis. It is the inverse projection which is present in the pelvis, which is ischial spine, which determines the fetal station during the process of the labor. So these are all about the function of the pelvis. Now we will discuss about the bone of the pelvis. So this is the pelvis, and this is the way to how to hold the pelvis like this. We have to hold the pelvis like this, and we will discuss now what are the bones of the pelvis. So first, the pelvis bones of the pelvis consist of two innominate bone. Two innominate bone, the sacrum and the coccyx. So these are the two innominate bone. These are the two innominate bone. This is the sacrum and this is the coccyx. This is the two innominate bone, the sacrum and the coccyx, the last bone, sacrum. Now again, the two innominate bone are divided into the three parts, which are the ilium, ischium and pubis, which I will show you. This is the two ilium, then this is the ischium, this is the ischium, and this is the pubis. This is the ilium, this is the ischium, and this is the pubis. Now coming to this ilium bone, which has the parts, which is we can see that this is the border of the ilium, the two ilia. This is the border, which is known as the iliac crest. This border is known as the iliac crest. Now the anterior portion of the iliac crest, there is a spine which is known as the anterior superior iliac spine. This is the superior portion of the spine, that's why it's called as anterior superior iliac spine. Then inferior also there is a spine present, which is known as the anterior inferior iliac spine. Like the same way the pelvis have in the posterior region, the spine is also present, which is known as the posterior superior iliac spine and the posterior inferior iliac spine. Okay, posterior superior iliac spine and the posterior inferior iliac spine. The same reason this is also present here also. Okay, now this is the spine of the ilium. Then we can say that the ilium is the largest bone of the two innominate bone. This ilium is the largest bone of the two innominate bone. While, as we all know that while in the resting position, we used to rest our hand like this. So we used to rest our hand on this iliac crest, the border of the iliac crest. We used to rest our hand like this, which is come on the border of the iliac crest. So this is all about the ilium. Now moving to the ischium, this part. Now moving to the ischium, we can see that there is a thick part over here. Ischium bone, this is the thickest bone, which is known as the ischial tuberosity. this bone, this two bone, which is known as the ischial tuberosity. This is the thickest and the strongest bone in this pelvis. Okay, when we used to sit on these two bones. These are the two stronger bone. Our whole body weight will bear on this two bone. That's why this is the two strongest bone, which is known as the ischial tuberosity. Then in ischium there is an foramen. See, this is the foramen. This one is the foramen of the ischium, which is known as the acetabulum. This is the foramen, which is known as the obturator foramen. Okay, then there is a cup-like structure is also present in the ischium. This is the cup-like structure. See, this is the cup-like structure, which is known as the acetabulum. Usually our femoral bone's head fit on this acetabulum, and which help us to move or run or sit. So the head of the femoral bones fits on this acetabulum. Okay, now there is an inward projection present in this ischium, which is known as the ischial tuberosity. There is an inward projection, which is the prominent projection, which is known as the ischial spine. This is the ischial spine. Okay, which help us to determine the fetal head station, which during the process of the labor, this ischial spine which help us to determine the fetal station. Okay, then in ischium there is a curve present which extends from this posterior inferior iliac spine to the ischial spine. There is a curve present posterior inferior iliac spine to the ischial spine. There is a curve present which is known as the greater sciatic notch. Then from the ischial spines to the ischial tuberosity is also a curve present which is known as the lesser sciatic notch. The function of this sciatic notch is the sciatic nerves and nerve supply, blood supply will enter from this curve, okay, to the pelvis. So this is all about the ischium. Now coming to the pubis. This is the anterior part of the pelvis, this is the pubic bone, where the two bone meet. It's the symphysis pubis. See, there is an cartilage over here, symphysis pubis. This is the symphysis pubis. In pubis there is two oar-like structure present, which is from superiorly is known as the superior rami and inferiorly is known as the inferior rami. This is the two oar-like structure present in the pubis. The two inferior rami joins to form the pubic arch. See, this is the pubic arch, which is usually 90 degree. Which is suitable for the process of the labor, normal labor, okay, normal delivery, which is suitable for this 90 degree is suitable for the normal delivery process. Then this is all about the symphysis pubis or pubis. Now coming to the sacrum. This is the sacrum. This one is the sacrum. See, sacrum, which is made up of 5 fused bone. The sacrum is made up of 5 fused bone. There is one prominent in the sacrum present, which is known as a sacral promontory. This prominent is known as the sacral promontory. Then lateral to this sacral promontory, a wing-like structure is present, which is known as wings of sacrum or ala. Wings or ala. These two bones are wings or ala of the sacrum. This is a sacrum which is wedge shaped and made up of 5 fused bone. Okay. Then besides the sacrum is a rough area is there, which is attached to the pelvic muscles and all. Okay. Now the last bone, which is this here, the small bone is there, which is known as the coccyx, which is made, this is a triangular bone which is made up of 4 fused bone. This is the coccyx, this is triangular in shape, and it is made up of 4 fused bone. So these are all about the bones of the pelvis. Now we will discuss about the joints of the pelvis. The pelvis has total 4 joints, okay? 1 symphysis pubis, 2 sacroiliac joint and 1 sacrococcygeal joint. See, this is the pelvis We all know that where two bone join together is where there is a joint present. Where the two bone joins, where the joint present. Okay. So first of all, the one symphysis pubis. See, there's a two pubic bone join where the symphysis pubis. This is the symphysis pubis. Next one is the two sacroiliac joint. These are the two sacroiliac joint where the sacrum and the ilium join. This is the sacrum and this is the ilium bone. So where it meets is known as the sacroiliac joint. The two sacroiliac joint. These are the two sacroiliac joint. Then there is one sacrococcygeal joint. See this, where the sacrum and the coccyx. This is the, I will show you, where the sacrum and this small bone is the coccyx. Where the sacrum and coccyx meets, there's the joint present, one sacrococcygeal joint. This is the only movable joint in this pelvis, which is the sacrococcygeal joint. So we have discussed about the joints. The pelvis has four joints, one symphysis pubis, two sacroiliac joint and one sacrococcygeal joint. Now we will discuss about the ligaments in the pelvis. As we all know that where all the joints present in the pelvis, there are all the ligaments are also present, will be there. So first ligament is the interpubic ligament at the symphysis pubis. As we all know that one pubic joint is there, symphysis pubic. So there will be a ligament present here, which is the interpubic ligament. Okay. The next ligament is the sacroiliac ligament. So here sacroiliac joint is present, so sacroiliac ligament will be present here. Sacroiliac ligament, both the side sacroiliac ligament will be present here. Okay. Next ligament is the sacrococcygeal ligament. As I told you, there is a joint between the sacrum and the coccyx. So there is also a ligament will be here present here also, which is the sacrococcygeal ligament. Apart from these joints and these ligament, two another ligaments are also present in the pelvis. These are the sacrospinous ligament. This is a sacrum, so sacrum, and this is your ischial spine. So from the sacrum to the ischial spine, there will be a ligament present here. Okay, from the sacrum to the ischial spine, which is known as the sacrospinous ligament. Okay, then there is the sacral tuberous ligament. Okay, from sacrum to the ischial tuberosity, there is a ligament present like this. From the sacrum to the ischial tuberosity, this is a ligament which is known as the sacrotuberous ligament. So these are the ligaments present in the pelvis. Now we will talk about the parts of the pelvis. Okay, the pelvis is divided into three parts, which is the brim, cavity and the outlet. See, this is the brim of the pelvis. This round shape, this is the brim of the pelvis. After that brim, there is a cavity. See, there is a space inside the brim, which is known as the cavity of the pelvis. After that, there is an outlet. See, this is an outlet from which the baby come outside. Okay. First of all, we will talk about the brim of the pelvis. Now the brim of the pelvis, which has the 9 landmarks over here on the border of the brim of the pelvis. We will talk about the 9 landmarks first. Okay, these are the 9 landmarks. First of all, this is the symphysis. It starts from the anterior side and which comes to the posterior side. First starts from the anterior, then it comes to the posterior. Both the sides there will be a landmarks present, same landmarks are there. Okay, from starting to the anterior portion, there is a symphysis pubis. First landmark, this is the symphysis pubis. Then there is a pubic crust, pubic tubercle, then pectineal line. See, there is a line present which is known as the pectineal line. Then there is an eminence. See, there is an outward projection is there, which is known as pubic eminence. See, this is both the side pubic eminence will be present here. Then there is a line which is known as the iliopectineal line. This is the iliopectineal line. Then after that there is a joint. See, there is a joint which is known as the sacroiliac joint. So this is the sacroiliac joint. Then after that there is a ala or wing of the sacrum, anterior border of the ala or wings. Then after that there is a sacral promontory. So these are the 9 landmarks which is present in the brim, which makes the outer border of the brim. So during the process of the labor, we can identify the station of the fetal head by these landmarks. Okay. Now as we all know that after these brim, there is a cavity and there is an outlet. This is the cavity, this empty space, this is the cavity from where the fetal head occupies. Fetal head will stuck on this cavity. Then after that it will come to this outlet. The outlet is made up of the border of the tip of the this ischial tuberosity. This is the ischial tuberosity, tip of the ischial tuberosity, then the ischial spine and the tip of the coccyx. This is the outlet. Okay, outlet. I will again show you. This is the outlet which forms the bone by tip of the ischial tuberosity, then the tip of the ischial spine, then this tip of the coccyx. This is the outlet from where the baby come out through this. Okay, so these are the parts of the pelvis. There are 3 parts: brim, cavity and outlet. Now we will talk about the diameter of this pelvis. Okay, coming to the brim, the diameter, there are 3 diameters in the brim. Okay, the anterior posterior diameter, the transverse diameter and the oblique diameter. This is the anterior posterior diameter, then this is a transverse diameter and this is the oblique diameter. This is the anterior posterior diameter, this is the transverse diameter and this is the oblique diameter. Okay? Coming to the anterior posterior diameter like this, then this is also divided into 3: the anatomical diameter, the obstetric diameter and the diagonal diameter. Now we will talk about the first of all the diagonal diameter. Okay, the anterior posterior diameter. What is the diagonal diameter? Diagonal diameter is extends from the midpoint of the sacral promontory to the lower portion of the symphysis pubis, like this. Okay, midpoint of the sacral promontory to the lower portion of the symphysis pubis. Okay, which is normally 12 centimeter. In clinical practices, we can only measure this diagonal diameter because while doing in the process of the labor or in the last term of the pregnancy, while doing the PV examination, we used to insert our hand like this and the middle finger will touches on this and we can say that it is 12 centimeter. So this is the only diameter we can measure, which is the diagonal diameter. Okay, now coming to the anterior posterior diameter or anatomical diameter, now coming to the anatomical diameter, which extends from the midpoint of the sacral promontory to the upper border of the symphysis pubis, like this, to the upper border of the symphysis pubis, which is 11 centimeter. See here, anatomical diameter, which is 11 centimeters. See, this diameter is 11 centimeter. Now how will you measure this diameter? As I told you that we can measure only the diagonal diameter, which is 12 centimeter. If we subtract 1.2 from this diagonal diameter, we will get this anatomical diameter, which is 11 centimeter. Okay, now we will talk about the obstetric diameter. Now it extends from the midpoint of the sacral promontory to the midpoint of the symphysis pubis, little bit down from the upper portion of the symphysis pubis. This is the mid portion of the symphysis pubis. So like this. Okay, so this is 10 centimeter. Okay, so this diameter is 10 centimeter. Now how will you measure this diameter? As I told you that we can only measure the diagonal diameter. If we subtract 1.5 to 2 centimeter, we will get this obstetric diameter, which is 10 centimeter. Okay, so this is the AP diameter, anterior posterior diameter of the brim. Now coming to the oblique diameter. like this. Okay, this as I told you, the oblique diameter which extends from the sacroiliac joint to the opposite iliopubic eminence. Oblique diameter, this is the sacroiliac joint to the opposite iliopubic eminence. As I earlier I told you about the iliopubic eminence. This is a landmark I have told you early. So this is the sacroiliac joint, this is the iliopubic eminence, this is the oblique diameter. Okay, the oblique diameter, it is 12 centimeter. Okay, this is 12 centimeter in diameter. Okay, now we will talk about the transverse diameter, like this, transverse diameter of the brim. Here it is the transverse diameter. Two iliopectineal line joins where this is the two iliopectineal lines. Okay, this is the two iliopectineal lines. So this diameter is 13 centimeter. So this is the diameter of the brim of the pelvis. Now coming to the diameter of the cavity, the cavity is equal in all sides, it is round. So the diameter of the cavity is 12 centimeter and the depth of the cavity is 4 centimeter. Okay, because the cavity is equal in all sides, the diameter will be the 12 centimeter and the depth of the cavity will be 4 centimeter. Now coming to the outlet of the diameter. Okay, now coming to the outlet, there is a diameter which is the anterior posterior diameter and there is transverse diameter. This is the anterior posterior diameter and this is the transverse diameter. There is no oblique diameter in this. In the anterior posterior diameter, it extends from the lower border of the symphysis pubis to the tip of the coccyx. Okay, this is the lower border of the symphysis pubis and this is the tip of the coccyx. So like this, which is 13 centimeter in diameter. So this is the biggest diameter, which is 13 centimeter in outlet. Okay, now we're talking about the transverse diameter. This is the transverse diameter between the inner border of the ischial tuberosity, which is 11 centimeter. This is the transverse diameter. Okay, inner border of the ischial tuberosity, where like this, which is 11 centimeter in diameter. So this about the diameter of the pelvic, brim, cavity and outlet. So I have explained you about the pelvic function, then I explained you about the bones of the pelvis, then pelvic joint, ligaments, parts of the pelvis and diameter of the pelvis. So I hope you have all understood this topic. Thank you. Thank you.